Today I'm going to talk to you about chronic illness and coronavirus. I know we are all tired hearing a lot about coronavirus, its treatment, its symptoms. Now today I want to divert to another section, which is chronic illness during coronavirus period. People who have chronic illness and been taking medications, and how will that affect coronavirus and the severity on it. First of all, coming to the point of chronic illness, let's talk about respiratory illness at first. A lot of people, as we know, have succumbed to respiratory illness when we look from the past. So main respiratory illness are chronic asthma, COPD, emphysema, bronchitis, and a lot of other occupational lung diseases. We know a lot of people are smokers. Smoking is a very huge risk during this coronavirus pandemic. Smokers need to cut away the smoking habit or must quit smoking, or else they will have severe diseases and severe effects due to this coronavirus. So respiratory illness people must be using or may be using inhalers. So what I have for them is they have to continue using their inhalers and must never stop using them. And if you have any symptoms such as cough or any more sputum production, you must inform the health authorities as soon as possible. Next category, we should look into heart diseases. We know a lot of people have heart disease, and a pre-existing risk factor for heart disease is hypertension and diabetes. So people with heart disease, we know, may be on blood thinners, they may be taking aspirin, a lot of drugs. So during this coronavirus period, you must never stop these medications. Your doses have to be perfect, and you have to refill the stocks and must have medicines for at least 1 to 2 months with you, because you may never know when you're going to fall for a crisis. So you must never stop taking the medications, and heart disease people must have their heartbeats checked. If you have a smartwatch or smart mobiles, it is easy for you to monitor the heartbeats or your ECGs often at your own home. Next category of illness, when we come into, it's kidney disease. Many people who have diabetes or hypertension are prone to develop kidney disease and may be taking treatment for kidney disease. There are people who are undergoing dialysis once a week, twice a week, thrice a week. So you have to be informed that you should not miss any period or any scheduled dates of dialysis. Coronavirus and kidney disease may not have direct effects, but you should not miss your dialysis, which may lead to the aggression of your and progression of your kidney disease. Next category which we have to look is people undergoing chemotherapy or people who have a weakened immune system, such as people who are undergoing treatment for cancer. So these kind of people are very much prone to get any kind of infections, and especially during this pandemic of coronavirus, you should be very alert. You should keep and be confined to your own home, and you should avoid crowd at all times, and you should be having a very healthy diet to prevent falling prey to any infection such as coronavirus. People who are on treatment for any kind of neurological diseases. We know there are many neurological diseases. They are stroke, cerebral palsy, Parkinson's disease, motor neuron disease, and people who have been taking medicines for this for so long, they need to continue the medications, because if they fall victim to having no medications, they may succumb to develop any kind of infections, and it's easy for them to fall prey for infections because most of the neurological diseases come into the category of elderly people. And talking about elderly people, the people who are at risk mostly for this kind of infections, especially coronavirus infection, are elderly people. So make sure that you continue your medications, and you should not miss medication at any point. Coming to chronic liver disease and the coronavirus may have certain connection, because when the coronavirus affects your body, there are certain parameters which we check in your blood. So it has many factors of changing the blood parameters. One among it is the liver function test. So coronavirus has some relation with liver disease or liver. So chronic liver disease people should be very alert and should be confined to their own homes and must take very high precaution not to contradict this coronavirus. And also people who have hepatitis and are undergoing treatment for hepatitis must be very careful and should stay at your own home and must continue medication at all costs. Next category are pregnant women. There have studies which are going on to prove that pregnant women and coronavirus have some kind of relation. But as of now, there are no confirmed studies which prove that pregnant women and coronavirus have a greater effect. So pregnant women must be careful because they have their dietary storage must also be par with the one which, because they have their fetus developing inside their body, so they must have a very healthy diet and must be confined to their own home. And even if you don't or you cannot go for checkups in between, you can call your doctor over the phone and inquire about relevant information, and the doctor will advise you on what to do. And do not get scared because you miss 1 or 2 appointments when you are pregnant. A majority of people are diabetic. So diabetic people must be extremely careful during this coronavirus season, because if you have high blood sugars or if you are a hyperglycemic, the chance for you to fall prey to any infection is very high. So my advice to you who all are diabetic are, you should keep your blood sugars checked at least once a day or maybe once in 2 days, because always need to keep your blood sugars under control. You will have a weakened immune system when you are a diabetic person. So do not miss your insulin doses, do not miss your tablets, and just keep your blood sugar check once in a day or at least once in 2 days. And your diet also need to be controlled at this time. Just keep away from any sugary stuff, keep confined to your diabetic diet, and because of no exercises and because you cannot go out and perform any active exercises, you can walk in your own home or just use the stairs in your apartment or in your house, and make sure you don't touch anywhere or you don't put your hands on your face after having this exercise. So just be confined to your home and do upper body exercises whatever you can at this period of time. Next category is hypertension. People who are hypertensive and been on drugs for hypertension need to be confined to the medications continuously, because hypertension is also a risk factor for coronavirus. Several studies have emerged that hypertension is directly a risk factor for coronavirus disease. So you need to take your medications on time for hypertension. That is a very important factor. Hypertensive people need to take the medications at correct time of each day to keep your blood pressure under control. A lot of people have been asking me about flu jab or a vaccination for flu. See, what we have to understand is flu jab and coronavirus are two separate entities. See, we have a lot of vaccines or flu jabs for many kind of influenza viruses and other kind of viral fevers or etc. And for coronavirus, this is no safety for taking a flu jab. So if you're planning to take a flu jab, I would request you to wait and let this period tide off, be in your own home, and after this season of pandemic is down, you can get your own flu shot. And just a word of caution that flu jab is not a protection for coronavirus disease. Next, what I would like to tell you is keep your diet very proper. Have a proper diet, a balanced diet. Be healthy, be active, do exercises which you can do at your own home, do upper body exercises, and be in a very good and positive mind that we will overcome and we shall overcome this season of coronavirus together. One last piece of advice: if you are having any symptoms of coronavirus, we all know what are the symptoms of coronavirus. Do not hesitate or be not dismayed to tell the authorities, and do not think that other people will come to know that I'm having these symptoms and I'll be taken in an ambulance. And one habit we all must change is to avoid spreading these fake messages and spreading the videos and photos of people who have been taken through the ambulances and who are affected by coronavirus. Let's stay safe, stay at home.